Hello, I'm Dr Louise Newson. I'm a GP and menopause specialist, and I'm also the founder of the Newson Health Menopause and Wellbeing Centre here in Stratford-upon-Avon. I'm also the founder of the free Balance app. Each week on my podcast, join me and my special guests where we discuss all things perimenopause and menopause. We talk about the latest research, bust myths on menopause symptoms and treatments, and often share moving and always inspirational personal stories. This podcast is brought to you by the Newson Health Group, which has clinics across the UK dedicated to providing individualised perimenopause and menopause care for all women. Today, I've actually got one of my patients who very kindly has agreed to share her story so other people can have a think and a listen about, well, shared decision making choices and as an individual. So welcome, Lesley, to my podcast today.
Hi, Louise.
So I met you a few months ago now, and you've come from a sort of medical background, haven't you? Do you mind talking about your job and what you have been doing in the past?
Yeah, so I'm a nurse. I trained as a nurse a long time ago. In July 87 I started, which was years ago.
Yeah.
And I was traditionally trained and now a district sister. And I have a caseload with another sister. And it's sort of quite high pressured and lots of decisions to make about patients and their care. And so I have a background, and I worked in oncology before, years ago, in Beaver Park in Northern Ireland. That's where I'm from. And
Yes.
and I look after my mum. She's elderly. She's 92.
Wow.
Yeah.
Okay. So you've nursing's changed over the years, and I started my medical training in 1988, so a long time ago as well. And having nurses who have huge amounts of experience is so important for any healthcare system. It really is. But, and I say but, because when I first met you, you weren't working, were you? You weren't able to work the way that you have done and are now. And you were having lots of symptoms that obviously led you to come to speak to me. But do you mind talking about what had happened for your symptoms to occur and you not to be able to work in the same way?
So I suppose I've had a long history of having heavy periods for years and years, and my mum had the same. So then I went on 2021. I went on HRT at the recommendation of a friend because I was having dry eyes, but mostly I wasn't having hot flushes and I wasn't having night sweat. I was having just other symptoms, but long term, I was looking into the future, and I thought I would have osteoporosis because I would have bone pain, etc. And and also just prevent my mum had colon cancer. So I just wanted to so my cousin actually told me that the benefits far outweigh the risk. So I took HRT patch before I ever met you, before I even knew you existed. And I then because I had to go on the progesterone estrogen patch. So when I was on estrogen, it was great, and when I went on the progesterone patch, I had huge blood loss. I had clots the size of my palm of my hand, and my hemoglobin dropped from 12 to 8. So I came off the HRT because I just couldn't sort of continue with it. And I went then and saw my GP, and she referred me for tests. And I had a hysteroscopy in December of that year, and in January the biopsy came back clear, and then they wanted to put a coil in. So, but I've never been sexually active. Okay, because I have a faith and I don't believe I should live in sin, etc., etc. And I've never met anybody that I'd want to spend the rest of my life with. But fussy and choosy, but that's fair. Yeah, so I went to I went to see a herbalist because I didn't want surgery, gynae surgery, and it's quite embarrassing. So I went to then uh, to see a herbalist, and so he put me on medication, and then I went to see the gynecologist, and she wanted to bring me in on the June of 22 to have a coil put on. So I said I'd like to try the herbal medicine first, and so I tried the herbal medicine, but by August it worked partially. It did help, and I didn't have much blood loss, but I was still bleeding basically every day for 3 or 4 months. And so then I rang the consultant up in August, and I said, look, I can't deal with this anymore, and I'd like to be put on the list again for a coil, which I was, it was mentioned before, and I'm due for review in September. So they put me on a cancellation waiting list, and I went for my coil insertion on the 30th of September 22. And so whenever they did the coil insertion, my womb looked fine. They weren't concerned at all. And so whenever they rang me then in December, out of the blue, and said, had you been for gynae surgery? And I said, yes, I had a coil put on. And then they said, well, could you come in to talk to us about the results? And I said, okay, when? Today. So then the alarm bells start going. And
Yes.
yeah, and bring somebody with you. So then, you just.
So you knew there was
something.
something. Yes.
Yeah. And so then I went to Derry that day. That was where my biopsy had been done, and that's the region I work in. So or live in. So I went, and my cousin went with me, and I was told that I had stage 1A endometrial cancer. And so because I'd worked in Beaver Park with radiotherapy, I said, so will I need internal radiotherapy? And I was told no, I wouldn't at that stage because they thought they'd caught it early enough. But because it hadn't been red flagged, because it waited for 12 weeks, by the time I had my MRI done, it had spread from my endometrium into my myometrium, just onto it slightly. So I was stage 1B, and I needed then internal radiotherapy and a full hysterectomy. So I had a surgical menopause, even though I was 54 and I had sort of started the menopause and I had some symptoms, but I was a bit like my mum. She sailed through, or seemingly sailed through, and so and when I was on the Western Trust, the surgeon there said, "Don't touch estrogen. You can't take it." So then, because I had endometrial cancer, they sent me to the Belfast Trust, and I'd worked on the Belfast Trust before, and I spoke to one of the oncologists, and I said I was having a lot of brain fog, and wondered whether I could get back to work, etc. So she said, "Well, you'll have to, we'll refer you to the HRT clinic in Belfast in the Mater, and but you'll have to wait a year before you can take estrogen." So I was happy enough, I suppose, to go with that. And then the reason I contacted you was I thought maybe I could go on testosterone if I wasn't on estrogen, and get my brain function back. So that was really, why I contacted you.
Yes, and I do remember actually the first time I met you, because I was really struck that you, who's been a very dedicated healthcare professional working as a nurse, was really struggling even to, I don't want to be rude, but even to get a sentence together.
Yeah.
It was quite difficult to sort of get. Would that be fair to say? I'm sorry, Lesley,
No.
I don't want to undermine you, but
no,
it
completely floored.
It was quite difficult.
Yeah, completely floored
and it was. I just remember you trying to explain how you were feeling and everything, but your words weren't quite coming out. You were quite hard to actually understand what was going on, but you were very frightened and scared because you didn't want to end your career. You knew you still had more to give to your job and to your life as well. And even you enjoy reading and everything else. You felt like things had been taken away from you and you had no control, which I hear a lot in the clinic.
Yeah, I just felt like, the ad on the TV, Macmillan and the man in the desert with the
Mm,
wind howling round him. And
mm,
I remember my cousin saying, and I find this a lot with people who have cancer. They treat you, they cut out whatever they need to cut out, the surgeons and the oncologists do whatever they need to do, and you're dropped, and
mm,
you drown. Like I drowned emotionally, physically, spiritually, mentally. I drowned, and my cousin said, Lesley, I watched you drown, and unless you have faith or a purpose or a way through, but my reason for contacting you as well was I'm not married. I don't have a huge income. I had savings, but those were running out. Yes, I'm well doing because I'm in the NHS and I get 6 months full pay, 6 months half pay. But that runs out and there are no benefits. There are no, there's a Macmillan grant of up to £300, which doesn't, cover very much. And you're sort of left to flounder. And um
mm,
and so I'd go on to there's an organisation in Cookstown which is a voluntary organisation, Caris, and I got counselling. But you only get 6 sessions and then, you're sort of expelled or, you have to sort of then figure out the next stage of the journey yourself. And because my brain wasn't working, I couldn't get my thoughts out at all. And I thought, how will I ever manage to go back and be a nurse and do the job I
mm,
do and be articulate with health professionals and patients and be um, compassionate? And I was exhausted. I wasn't really sleeping, and and So, and I was doing all that I'd been asked to do by the health professionals. I'd gone to see a genitourinary urinary physio, and I had done the exercises and the things that I was advised to do. But and the one thing that really helped as well as the HRT was there's an organisation in Northern Ireland called Action Cancer, and I went to a positive living programme through them, and they also did a menopause HRT when you've had cancer. And that really helped, And my cousin, who is a nurse as well, she came alongside and she said, Lesley, the benefits far outweigh the risk. Um, my cancer is estrogen receptive, and they just bandy that about like no man, but they don't
mm.
actually think of the consequences for your life. And I knew I needed to get back to work, and I got back to work within the year because I was in HRT. But if I hadn't been in
Mm.
HRT, I may not have been able to get back to work.
Mm. And it's really significant and important. And it's, as many people know who are listening, and I know you know as well, Lesley, is a lot of my work is just about choice. And in medicine, when I started doing medicine, I did a lot of hospital medicine, and it wasn't about choice. It was about prescribing, making a diagnosis, giving people medication, reviewing them in a clinic in an outpatient setting in the hospital. Never once did I really think about the continuity of care, because in hospital often, especially as a junior doctor, you've moved on in six
Yeah,
months, so you don't see the people, you don't have this as you know, this sort of long-term relationship. And then in general practice, my trainer said to me, Louise, you're going to have to be careful here, because these are people, they're not diseases. You have to get to know them and you have to share any uncertainty with them, but you have to enable them to be part of their treatment journey. and I wasn't sure what he was talking about at the start, but it's so important. I do not live other people's
No.
lives. I do not know what it's like to have endometrial cancer, and I do not know what it's like to live after endometrial cancer. I've had a hysterectomy for another reason that was benign, so I sort of know that, and I've been menopausal, but my menopause is different to yours, and ours is different to other people's. And so in medicine, I find it really hard to just say no. And it's because often people say, well, we haven't got good evidence. We're never going to have good evidence to certain things. But then, even if we do have good evidence in 20 or 50 or 100 years' time, it's not going to help
No.
you in that immediate situation. And then when we look at endometrial cancer, so that's cancer of the lining of the womb, there's about 9,700 cases in the UK. So it's common, but it's not the commonest cancer, as you know. But actually the life expectancy from it is really
Yes.
good. Like, I would never want to choose a cancer, but if I was choosing one, I would choose an early stage low grade endometrial cancer,
Yes.
because it's a curable disease, and actually outlook from it is better than if I'd been diagnosed with an osteoporotic hip fracture,
Yeah.
for example. And you
Yeah.
know that as well as I do. And which is good. So yours was caught early. That's great. You know, really, hopefully, we can never say 100% in anything we do, but hopefully it's a curative
Yeah.
operation that you've had and treatments. So you've got your next journey to look at and embrace and enjoy, hopefully. When we look at these receptor statuses, as many people listening know, we've got estrogen receptors on every single cell in our body. So it's no surprise that you've got estrogen receptors on your cancer. But that's a good thing, because if you didn't have estrogen receptors, it often shows that the cancer's mutated, and sometimes that means it's become a bit more aggressive. So actually, estrogen receptor positive is good. But if you find it, people then think, oh, it's been caused by estrogen. You can never have estrogen. So, and that's where some of the confusion lies. But if you've had all the cancer removed, it doesn't matter so
Yeah.
much, because you're not fueling it anyway. And then often we do give progesterone as well to some women who've had endometrial cancer. And testosterone, like you quite rightly say, is another hormone that some people will benefit from for their mood, energy, concentration, stamina. And I've heard from a lot of women who say, well, I don't have a sexual partner, therefore I'm not allowed to have testosterone because I don't need a sexual libido. And I find that's really quite harrowing, because it's not just about improving libido, is why how testosterone can help. So often the combination of the right hormones, and you mentioned about pelvic floor, and vaginal hormones are very safe for women who've had cancer as well, including breast cancer, because they only work locally. And certainly there's a lot of women who have vaginal symptoms and urinary symptoms, and that's really important to consider as well. So I know when we first met, we had a conversation. I put everything out and said, you can try and see, because God forbid, if your cancer came back in the first 3 months after being on HRT, it wouldn't be the HRT, it would have come back
Yeah.
anyway. So in 3 months, you can try, and then you can decide. And it's easier to decide once you've started something, because otherwise you don't know how you're going to feel. And I'm pretty sure that was a conversation we had, because that's what I usually have with
Yeah.
patients. So you decided to try, and you started to feel better, didn't you?
Yeah. Yeah. I mean, basically, sort of a week, maybe late, and I used to have dry eyes, and I used to see, and all that has gone. And I was sort of maybe starting to have night sweat, and that's gone. And I have to use a dilator once a week just to keep for examinations and that. And that has helped with all of that. And the pessaries. And I've gone to my
Mm.
GP, and she has agreed to give me estrogen. So then I only really get the pessaries and the testosterone from Use and Health. And it's great just that um,
Mm.
I have my life back. I have quality of life. Um, Cancer surgeons and oncologists think about quantity. I think about quality. And quality of life is
Yes.
the, if you don't have quality of life, life's very, very difficult. And I've seen so many
Mm.
people they've had breast cancer or other cancers, and they're not on HRT, and they struggle daily, and it, it's like I don't want cancer or endometrial cancer or my menopause, surgical or non-surgical, to be a defining moment in my life. I want to move on from this. And sometimes it just seems like a surreal nightmare. It's gone. I'm starting to, I'm working again. I'm looking into doing maybe lay ministry within my church because I have my head back, and I don't have fatigue. I'm able to sleep well, and I'm able to think cognitively well. And also for long term, I don't want. My mum had spinal fracture. She had colon cancer. There is a history of, dementia. I don't really want to go down those roads, and I think probably the long term effects of HRT haven't been written yet. Because I just think if there are receptors in your brain and there's so many neurological diseases, and I have to probably work till I'm 67, and because of the government and their mismanagement of the pension schemes, etc. So because I'll have to work till I'm 67, if I wasn't an HRT, I wouldn't be able to do that. And it's life changing.
Yeah. And I hear it a lot, and there's a lot of people who are really skeptical about HRT and think that women take it for lifestyle or for nice skin and hair. And I find that really both upsetting, but also very disparaging towards women, actually, because we are more than our skin and hair. We are about our brains more than anything else. And this morning I was lecturing a divisional meeting for the Royal College of Psychiatrists. So there were lots of psychiatrists in the meeting. And I lectured to them for an hour, and then we had half an hour of loads of questions. It was wonderful. But it is a cognitive disorder. The commonest symptom actually is more brain fog, memory problems, but also low self-esteem, reduced self-worth, very common. So women do become invisible. And in my updated book, the paperback book of the definitive guide, I've written, we write a lot about the symptoms, but Joanne Harris, who is an author, wrote about women being invisible and how convenient it is in society for women to be unseen, unheard. And it's almost like this: you put up and shut up. You should be thankful that you've had treatment for cancer and, you're still alive. But actually that isn't enough for a lot of people. And, and I think it is about choice. I think a lot, and I know this sounds a bit weird, but see what you think of it. But I think a lot about when I buy a car. My daughter the other day was asking about the first car I ever bought as a medical student, and I was very lucky. I saved a lot of money, and then my grandfather said, "I'm going to give you a bit of money so you have it now before I die, because I don't want you to get as bad a car as you're going to get." So I had a very small Vauxhall Nova. It was quite a few years old, and I cycled down to Stockport from Manchester to the garage, and I met my mum there, who got the train up so I could show her this car at the garage. So cycling down was quite a long way. I didn't have a helmet. I had a really old clapped out bike, but that's what I used then. And then I got in the car. I liked it. It sounds really vacuous. I like the interior. I like the colour. The salesman was telling me how brilliant and reliable and this, that, and the other it was. So I bought it, and it was the best thing that I'd done for a long time. I really enjoyed it. It took me off to the Lake District and did all sorts of adventures in it. I didn't read a randomized control study seeing if it was the best car. I didn't think about my safety. I didn't think about my safety getting on my bike. But that for me was what I wanted. And I was very fortunate to be able to have this car. But I think about when we drive our car, there is a risk of crash. Of course there is, and the roads have got busier. So over the last 30 years, it's more of a risk. But I still drive. I drive to pick my children up. I drive to meet people. But that's my choice. I'm an independent adult. No one's telling me that the car I've got now drives a lot faster than the car I first got when I was 20. But actually, that's okay. I'm allowed to choose. But I think I know you've made choices that are right for you. And also, no one's forcing you to take HRT or not take HRT, but you had that decision, that ability to decide taken away from you when you had your operation. And that's what I feel really sad with this, because you are allowed to decide which is the biggest benefit you're getting and which is the biggest risk. But actually, it's not just the risk for you of not taking it. If you weren't on HRT, I don't think you would have been able to continue looking after your mother. You wouldn't have been able to continue working as a nurse. So other people would have been impacted by that decision.
Yeah, I think that's a major factor, and if I wouldn't have been able to pay my mortgage. I wouldn't have been able to keep my mum in the home that she's lived in for most of her life. And those things carry a lot of emotional weight and a lot of profound weight, that I can keep my mum in her own home and that I can go out to work and earn enough and that I can adjust my hours to that suit me and that I have a quality of life. And it's not about all the research studies and all that. I know all of it, you hear all of that and it's about the quality of life today. And yes, I may develop cancer again. I hope I don't. But if I do, they can treat cancer, but they can't treat osteoporosis in your spine. They have no treatment for dementia. They're working at it. They may develop it, but right now I don't have dementia. I'm back at work. I have a life that I am happy with and content with, and I have a dog that I can take out walking every day, and if I wasn't on HRT, I don't know that I would have been able to look after my mum and keep the whole thing going. And one of the reasons I did reduce my hours is just to give me a better quality of life as well. Just time to be able to, and also I think radiotherapy causes fatigue, and that is
Yes, it
yeah.
does.
And sometimes I get really tired and I'm building up my resilience again and I can see a way forward. Whereas when you first met me, I didn't know how I was going to get through the next day. And I didn't want to go on big heavy doses of antidepressants. I have a friend who's on an antidepressant because she's not an HRT, because and it's just not a way to live your life.
No.
And I think as well, a
It's
lot of them, they don't, consultants and oncologists, they don't really think about your life. They don't think about the ramifications. And it's not patient-centered. It's just it's surgeon-centered or oncology-centered. They treat the cancer. They forget about your life. They forget about that you're a person, that you have needs, and you have maybe a husband or a family. And I don't know how people who have husbands and family who, I've just seen friends struggle deeply with just symptoms because they're not allowed on HRT.
Absolutely, and the suffering, not just in the UK but globally, is sort of palpable, really, and a lot of it is avoidable. And life is hard enough anyway. So I'm so grateful for you sharing. Well, it's beautiful but awful at the same time.
Yeah.
what you've experienced, but the strength of character that you have has just been shining through. And I knew that when I first met you, that this is somebody who's got some fire in her belly. She knows what she wants. You're a really determined lady, and you have been over your years, but it's come back. And I just feel such a privilege to be part of it, Lesley,
Thank you.
and for you to share your story. I'm really, really grateful. So before we finish, you probably know I always ask for 3 take-home tips, but I'm really keen to ask you 3 things that have helped you have the strength to make the decision and choices that you have, not just about your treatment, but in life in general, because I think listening to you, there's a lot we can all learn from you.
Okay, thank you. Well, I have a faith. I think if you have a faith, that helps. Not everybody will have the same faith as I have, and that's fine. And I think if you go out and try, and there's a lot of stuff out there for um cancer that isn't really research based. It's not good at all, and you have to sort of filter through. And I'm quite proactive, and so I found Action Cancer. I'd heard of them before all of this. I didn't really take them on board because it wasn't relevant to me. But through that I've learned about scar therapy. Scar therapy has really helped along my scar because it was just quite sore and would have caused me a bit of pain, and that has really helped with lymphedema around my scar. Um, and also just that whenever you've gone through this, you have to say goodbye to the old you. The old you has gone, and the old Lesley Henry has gone. She's not coming back because and in a way she needed to go. She needed to, because she was mad. She was, doing. Somebody said, you know, I used to be like a Ferrari. You're like a Ferrari, Louise. I was like a Ferrari, and I became like a pony and trap, because I just couldn't. So now I just, and you have to learn to pace yourself, and
Mm.
also watch film, watch things that encourage you, like The Darkest Hour, what Winston Churchill went through, and how he had to persevere. Listen to all the crap, that you're told, and discern through all the crap. And um, if I've loads of friends, and some really good friends. Some friends I've let go of through this. And it's just, I think, trusting yourself,
Mm.
and listen to your
Mm.
heart, and
Yeah.
and think that you are worthwhile, and that your life matters. It may be that you're a mum at
Mm.
home or whatever, but you matter to the people who love you. And even if you're in a difficult relationship, your life matters, and you're worth
Mm.
more. And also through um doing different programs. There's a positive living program that's done in Northern Ireland, and it's 2 days, and you can go to coaching, and it's just about how to re-energize your life and refocus and rebuild. And but HRT has been my savior in all of this, and has got
Mm.
me out of. There's a psalm in the Bible that says,
Mm.
um, I was put in miry clay, and God lifted me out. Well, HRT, with God's help, lifted me out of the miry clay.
Amazing way to end, and listen to your heart, I think, is just wonderful. So thank you so much, Lesley, for your time and sharing so many wonderful words with everyone. So I really appreciate it. Thank you.
And I hope it helps. That's what it's about. Yeah, helping others
Of course it
and
does.
passing it on.
Absolutely.
Yeah. And thank you. Thank you
Yeah.
for all
So,
your help. You're brilliant.
oh,
Yeah.
thank you. can find out more about Newson Health Group by visiting www.newsonhealth.co.uk. And you can download the free Balance app on the App Store or Google Play.